Medication. Definition: the administration of medication is a common but important clinical procedure that must understand. It is a way a medicine is administered to determine some extent whether the patient gained benefits or suffer any adverse effect. Know all the important considerations when administering medications. Oral medication administration. Purpose of oral medication: to provide medication that has systematic effects or local effects on the gastrointestinal tract or both. Assessment. Equipment and supply. 1. Medication cart. 2. Disposable medication cup. 3. Ma. 4. Drinking glass and water or juice. Know the reason why the client is receiving the medication, the drug classifications, usual dosage range, side effects, and nursing consideration.
Check the MAR or treatment medication record for the drug name, dosage, frequency, route of administration, and expiration date for administering the medication. If the MAR is unclear or pertinent information is missing, compare the MAR with the most recent physician's written order. Report any discrepancies to the charge nurse or the physician as agency policy dictates.
Verify the client's ability to take medication orally. Procedure.
Wash hands and observe other appropriate infection control procedures. Unlock the medication cart. Obtain appropriate medication. Read the MAR and take the appropriate medication from the shelf, drawer, or refrigerator. Compare the label of the medication container or unit dose package against the order on the MAR or computer printout. Report discrepancies. Check the expiration date of the medication. Use only medications that have clear, legible labels. Prepare the medication. Calculate the medication dosage accurately. Prepare the correct amount of medication for the required dose without contaminating the medication. While preparing the medication, recheck each prepared drug and container with the MAR again.
Tables or capsules.
Please package unit dose capsules into the medication cup. Do not remove the medication from the wrapper until at the bedside. If using a stock container, pour the required number into the bottle cap and then transfer the medication to the disposable cup without touching the tablets.
Keep narcotics and medications that require specific assessments such as pulse measurement, respiratory rate of depth, or blood pressure separate from others. Break scored tablets only if necessary to obtain the correct dosage. If the client has difficulty swallowing, crush the tablet to a fine powder with a pill crusher or between two medication cups. Then, mix the powder with a small amount of soft food, such as applesauce. Liquid medication.
Thoroughly mix the medication before pouring. Discard any medication that has changed color or turned cloudy. Remove the cap and place it upside down on the countertop. Hold the bottle so the label is next to your palm and pour the medication away from the label. Hold the medication cup at the eye level and fill it to the desired level. Use the bottom of the meniscus to align with the container scale. Before capping the bottle, wipe the lid with a paper medication and MAR together with the medication card. The label on the container before returning the bottle to its storage place. Lock the medication card before entering the client's room. Provide for client privacy. Check the client's identification band. Let me see your ID band. Okay, here's your medication. Methylamic acid 500 milligram tablet as pain reliever. Explain the purpose of the medication and how it will help using a language that the client can understand. Include relevant information about effects. Administer the medication at the correct time. Give the medication to the client within 30 minutes before or after the scheduled time. Give the client sufficient water or preferred juice to swallow the medication.
If the client is unable to hold the pill cup, use the pill cup to introduce the medication into the client's mouth and give only one tablet or capsule at a time. If an older child or adult has difficulty in swallowing, ask the client to place the medication on the back of the tongue before taking water.
Document each medication given. Record the medication given, dosage, time, and complaints or assessment of the client and your signature. If medication was refused or omitted, record this fact on the appropriate record. Document the reason and the nurse's action according to the agency policy. Dispose all supplies appropriately.
Replenish stock and return the card to appropriate place and discard used. Return to the